Welcome to Move with Care, where we explore popular activities, sports, and movements, and how they affect our spine, muscles, and joints. Hi, I'm Dr. Ken Howell, chiropractor here in London, Ontario at Intercore Health. And today, we are here at the beautiful West Haven Golf and Country Club, where we are going to explore an activity enjoyed by millions of Canadians, and one of my personal favorites, golf. Today here at West Haven, we are happy to have head professional Scott Loosely join us. Welcome, Scott.
Thank you, Ken.
Over the years, as a teaching professional and as a player yourself, you've experienced many injuries over the years. Can you explain some of those injuries to us?
I have. Over time and playing a lot of rounds of golf, I've had some lower back pain, which has moved up into my rotator cuff and my shoulder area.
And how has chiropractic care helped with those injuries over the years?
After seeing a chiropractor consistently, getting some adjustments, some exercises to build some strength and stretches, it has helped tremendously.
So today on Move with Care, we're going to address some of those issues that Scott talked about, specifically the shoulder, the middle back, and the lower back. One of the most commonly injured areas for golfers is the shoulder. The cause of these injuries is usually due to poor biomechanics of the golf swing. So when Scott sets up, this is perfect setup position. This is his lead shoulder, and this is his trail shoulder. So on his lead shoulder, what we want a full shoulder turn. But in many recreational and amateur golfers, they pull up. So when he pulls up, what happens is it creates a tremendous amount of strain and pinching in the shoulder joint. And that can lead to irritation and rotator cuff tendonitis. A proper shoulder turn, as Scott will demonstrate, has the shoulder turned, but also pointing straight to the ground. And that alleviates a lot of pressure on that shoulder joint. Today, we'll demonstrate a shoulder exercise that you can do at home or at the golf course to get your shoulders warmed up and enjoy a pain-free round. So today we have Jeremy here, who has a TheraBand, which you can get at your local chiropractor's office. And we're gonna demonstrate an exercise called shoulder flossing. So what we're gonna have is Jeremy stand shoulder width apart, his arms are right in front of him, and he's gonna put some tension in the TheraBand, okay? And so what we want Jeremy to do, slowly in a controlled motion with his arms straight, his elbows kind of locked, we don't want a bent elbow. He's gonna bring his arms back, up, over his head, and back down, stop around there, and then come back around. So repeat for me, Jeremy. Up, over, and around. So what this exercise does, it allows a lot of shoulder mobility and range of motion in his shoulder to allow for his golf swing to be a little bit better. If he finds it too hard, what Jeremy can do is he can widen his arms without elbow bend, go up, back down, and around. And if he finds it too easy, he can increase the tension in the TheraBand by making it shorter. So he's shortened it, he's gonna pull out, straight arms, back up, and around. So you wanna do this about, for a minute or two, maybe do 20 reps of this, and that'll keep your shoulders nice and loose. Low back pain is the #1 cause of disability globally. And as a chiropractor, it is a common condition that we see and treat in our clinics. The joints in the back like to flex and extend. They like to move forward and backwards. The lower back, the joints also like to move forward and backwards. But what they don't like to do is they don't like to rotate. So what leads to many problems for recreational amateur golfers is the extension and rotation in the low back can create something called facet joint irritation or low back pain. So Scott here is gonna demonstrate what not to do. So he's gonna swing, but what he does, he puts a tremendous amount of strain in his back. He extends and he's rotated. And over many repetitive swings, it can cause pain. And Scott's gonna demonstrate a proper biomechanical swing here. So he swings, he's nice flexion, nice rotation in his hips, not a lot of extension in his low back, which will help prevent low back pain. So now I'll show you an exercise to help with your middle back and lower back mobility and allow you to golf pain-free. So we're gonna get Jeremy here to get into tabletop position. So his knees under his hips, his arms underneath the shoulders, and he has a neutral spine here. We don't want a lot of arch, just be straight. So what we're gonna do is we're gonna get Jeremy to get an angry cat position. So he's gonna tuck his neck in, arch his back like an angry cat, nice round curvature here in his middle back. And then what he's gonna do is he's gonna release there, bring the upper back, middle back down, and then arch his lower back like a camel. So you should be a nice hump here. So do it again, Jeremy. Up like a cat, rounded shoulders, and then down and then arch back. So you should repeat this one set, usually about 10 to 15 times. And if you do this right before your golf game, you will notice an increase in your mobility in your spine, and it'll help you golf pain-free. Thank you for joining us, where today we talked about mobility and how it affects our shoulders, middle back, and lower back, and how increasing mobility will help you golf pain-free. If you'd like further help, please contact a chiropractor in your local community and follow us on the Ontario Chiropractic Association YouTube page.